Okay. Good evening, everyone. I hope you're all doing well. I'm pretty excited about this tonight because this is really like foundation of everything that we are going to be learning for the next 11 weeks now. And I think, not enough of this information is given to us during a lifetime. And especially as birthing bodies, as women, this is some of the most important. I think this is some of the most important information about our bodies that we can learn. Um, at least it was for me, and I didn't learn a lot of this until after I had my first baby. Hey, Ellen, how's it going?
Hi, it's going okay.
Good. All right, we're just getting started. You haven't missed much.
Okay.
But I really think this is going to be really helpful for a lot of you. So as we get started, make sure it looks like you're all on mute, which is great. I will probably ask you guys a couple questions. Feel free to unmute yourselves and answer. Feel free to ask any questions if you want in the chat, or you can also just kind of chime in. I think there's a way to like raise your hand. There's a little hand emoticon down there that you can click, and I will probably see it. If I don't, just unmute yourself and be like, hey, can you hold on a sec and let me know, okay? There is a lot of information in this one in particular. This is probably the most dense of all of the presentations, so be ready. But I'm going to try to go like kind of quickly, but not so quickly that you get overwhelmed. So I'm going to try my best. I might go over the time a little bit. I'm going to try to like move along. If I go over and you need to go, please go and do what you need to do. You can always come back and watch the rest of it when you're able to. If you're getting overwhelmed, if you're just like, this isn't going to happen, I can't even hear what's going on. Totally fine. You can go. I won't be offended. I know that you'll revisit it when you have time. So with that being said, I just want to also say before we get started that these workshops are designed to really just provide you with a foundational background knowledge about your body. There's going to be a lot of anatomy and physiology that I briefly touch on throughout, but the purpose is to give you visuals and terminology that might be helpful to you as you do exercises that we do throughout the program. You're not meant to retain everything. You don't have to memorize anything or take notes. I do encourage you to write down anything that might resonate with you or you find really helpful, because I know, at least in my brain, I can get really helpful information and it just like leaves right away. So if you find something that you find to be really interesting, or if you have a question, please write it down. Make sure that you don't forget it, okay? But there's not going to be a quiz or anything about any of this after, so don't feel like you have to remember, especially the anatomical terms. I like to give you that knowledge. I know for me, knowing the names of things can be really nice, especially when you're going to advocate for yourselves as a doctor or a healthcare provider. It's nice to know certain terms. It's nice to know those things when they talk to you about your body. I don't think we are told those terms enough because people think that we don't need them. But I wanted to just give them to you so that you can hopefully feel a little more empowered in understanding your body, even just knowing the names of things. All right. So don't worry if it just like leaves your brain. Totally understandable. You can always have this video to come back on and watch too. I am, and now in my personal experience and now in my professional experience, I'm finding that birthing bodies go largely unheard or really misunderstood in our society and even within our medical system. We are just not taught about our bodies, and that can leave us to feeling really powerless within our own bodies. So I'm hoping that this information can help you as you kind of move into this space where you're going to be doing a lot with your body and hopefully answering a lot of questions that you may have about some symptoms that you are experiencing. I'm approaching this from an exercise and movement standpoint. So even my knowledge base and my scope of practice is limited, but I'm here to provide you with the basic information and resources and moral support that you can use to move forward and make empowered decisions for yourself and your body, in addition to providing you with movement that is safe and has your postpartum body needs in mind, and your needs as a caregiver in mind, and the things that you do on a daily basis in mind as the primary focus. Okay. Also, keep in mind that this is a very sensitive topic. This is a sensitive area of our bodies for many reasons, right? This doesn't get talked about a lot because it is sensitive, both physically and socially and emotionally. We're going to be talking about a lot of your body parts that I think maybe like the generation before us just didn't talk about. I'm going to be using a lot of terms that might make you feel uncomfortable. I'm going to be saying things like vagina, and I'm going to be saying things like anus, and I'm going to be talking about the perineum. And so keep that in mind. I know that can be something that is sensitive around your children as well. And so just keep that in mind as we move forward. Also, your body holds a lot of things, a lot of feelings, a lot of memories and things like that. And so keep that in mind as we think about this area of our bodies. You may notice that there might be things that come up for you. And sometimes we are very cognizant of those things being connected, and sometimes we're not. So as we move through the week, if you feel like you are maybe a little more emotional than usual, you feel different or something that, maybe give yourself a little space to really think about those things and see if they're connected to what the work that we're doing this week. All right. And before we move on to the first slide, I want to ask you to start with, what has been your experience with the pelvic floor so far in your life? Have you heard about it? What have you heard about it? Do you know what it is? I just want to get a general feeling for where everybody's at.
I don't think I was ever taught exactly what that term means until I gave birth. And even then, it was still kind of like general, not very specific about either the different parts or like anything like that. Just kind of the term Kegels comes to mind too, obviously with exercise Kegels. So, but I have heard that there's a lot to do with stability, even outside of giving birth in the pelvic floor. So I am very interested in that. So yeah.
I think similar to Sarah, did not learn anything about it until I was taking birthing class. I don't think they told me what the parts were. So Sarah, I'm super interested in what the number of things are involved with it. But I know that Kegels for sure was something that I remember learning about, and like the ability to pinch off your, like stop your pee stream.
Yes. Carolyn, did you have anything you wanted to add? You don't have to.
I'm like Sarah, I didn't really know much about the pelvic floor. I wasn't really taught much about it either. And I sorry. They're getting ready to go in the hot tub, so anywho. Anyway, yeah. So I don't know a lot about it, and I just know things have changed down there. So that's about my extent of knowledge for that area.
Yeah, beautiful. Yeah, I would say that is all what you're saying is very common for just generally kind of what we're told, especially going into birth and things like that. It's very limited, like I said before. So today, hopefully you're going to leave feeling much more knowledgeable about that area and excited about the week ahead as we explore that within ourselves a little bit more. All right, so let's get started so we don't run out of time. Let's start with, what is the pelvic floor? It is a funnel-shaped group of muscles that connects your pubic bone, which is the front of your pelvis, like right above where your vagina is, right? Like right above your pubic area, to your coccyx, which is your tailbone. Okay. It surrounds your urethra, which is the passageway for urine, your vagina, and the base of the penis, because men have pelvic floors too. And also around the anus. So I have also a 3-dimensional model here to help you guys kind of visualize things a little bit more. I know a lot of these kinds of pictures, they're 2-dimensional and they really just show it as a very flat type of muscle group. And it is very much more 3-dimensional. So this helps a little bit more, help you see. And I know a lot of you are looking on your phones and it's hard to see. We're going to have some other visuals too, so don't worry. But you can see here in this model, it's very much like a bowl kind of shape and a rounder kind of rounded shape. And when I say that it goes around the urethra and the vagina and the anus, basically what I want you to think about is there are holes that go through your pelvic floor. So you have one for stool to pass through, you have one for urine to pass through, and you have a hole where your vagina is, where our babies pass through, and for sexual function, right? And so you have these holes that are around, and the pelvic floor is a bunch of muscles that are just surrounding all of those passageways through. All right. And the other thing to remember is that it is not just one muscle, it's layers of muscle and fascia, which is the connective tissue that goes over top of your muscle. And it supports your internal organs. It controls your bladder, your bowel, your sexual function. So just, on a basic level, which it sounds like you guys are already at, consider when you stop your stream of urine or you relax it so that you can let that urine go. That is your pelvic floor muscles around your urethra, allowing the stoppage or the passage of urine through. And so it does very much affect that movement of things through your pelvis, right? And into the outside world, including our babies. So we talked about Kegels really quickly. That's something that is thrown around a lot about when you mention pelvic floor. Usually the first thing people think of is Kegels or Kegels. We are going to be talking a little bit more about them. They are not inherently bad. I don't want you to leave this conversation thinking like they're bad for any reason. They are basically just a contraction of your pelvic floor. So it's a tightening of your pelvic floor in isolation. So it's like, that's the only thing you're tightening, right? And that's what a Kegel is. It is named after the physician who first kind of coined the term. He just like needed to describe it to people. His last name was Kegel. And so, and that is what we're taught, right? Is just stop that stream of urine. That's a Kegel, is tightening everything. And the issue with it is that we really aren't taught very much more than that about pelvic floor. A lot of times in childbirth classes, you're just taught that you need to strengthen your pelvic floor. That's most of the conversation that goes on around pelvic floor issues, is it needs to be strengthened, which you will find is not necessarily true for all of us, right? It's a little more complex than that. If there's one thing I want you to walk away with during the talk, it's the fact that our pelvic floor is incredibly dynamic, just like us. All right. It does many, many things, so much more than just contract. And just like us, it's required to be much more than just strong in order to function and do all of the amazing things that it needs to do. And in order to do the things it needs to do, it must be able to contract and relax, and those things are equally as important. It must be able to do fast and slow contractions, and it needs to be able to do both voluntary and involuntary contractions. And we're going to be discussing each of these things today as we move on. So don't worry, we're going to revisit this. But you can see there's a lot that it has to do. All right. It's not just something that tightens everything up. Okay. So here's another view that might be a little more telling of how it's shaped. There are a lot of layers in the pelvic floor, but for simplicity's sake, we're just going to stick to the idea of there being a superficial layer and a deep layer of the pelvic floor. Okay. So the superficial layer are the smaller muscles responsible for more of your resting tone in your urethra, which is that passageway for urine, and your anal sphincters, and for your sexual function. And so basically there you have this resting tone that's always present. Otherwise we would kind of just be releasing urine and feces all the time, right? So we always kind of have like a little bit of tone there. And then the deep layer of muscles is mostly what we're going to be focusing on today and during our exercises. And we're going to learn some of the names of it. But you can see that there are the four main muscle groups that are included in those deep muscles are the levator ani, the obturator internus, the piriformis, and the coccygeus. And again, don't have to remember those, but it's nice to have that in like your memory bank a little bit, right? Because they might be terms that you'll hear from time to time in regards to your pelvic floor, especially if you have dysfunction. We are mostly going to focus on the levator ani, which is also called a lot of times the Kegel muscle, because it is the muscle group that does the most heavy lifting of the pelvic floor. And it is actually made up of 3 different muscles. And I have the names of those as well. There's pubococcygeus, which is the muscle that most often tears during childbirth. So if you had a tear during childbirth, it's likely that it was your pubococcygeus. The puborectalis, which surrounds the anus, so that muscle that's just right around the anus. And you can kind of, I have this little, as a side note, I have on here a picture of the puborectalis and how it kind of sits. Let me see if I can get my cursor here. How it kind of sits around where your anus is, and it acts like a sling. It goes around it. I don't know if any of you have heard of a squatty potty. Probably, I feel like it's around a lot these days. The reason why that works well is because it changes the angle that your pelvis is sitting. It allows for a wider angle of your, it allows your puborectalis to kind of release around your anus, and that allows for the easier passage of stool, right? So if you're having issues with constipation or issues with straining on the toilet, I do recommend you look into a squatty potty. Now you know why they work. It's not just magical. It's there is a very specific, like, physiological reason why squatty, being in that position, helps a lot. Let me see. I'll get cursor back over there. Okay, so puborectalis, we have the pubococcygeus and the iliococcygeus. And actually there's another one as well, but the point being, there are multiple muscles with multiple attachments running in multiple directions in order to create your pelvic floor and make it possible for you to contract and relax it at any given time. And it's very complex. It's a complex muscle group. There's a lot going on there, and there's a lot that's affecting it. And it's really important for us to have a decent handle on at least how this particular part of our body is meant to function. All right. So if you've ever taken an anatomy or physiology class of any type, you might have encountered the terms fast twitch and slow twitch muscles. These are 2 different muscle groups. Fast twitch muscles are typically more powerful and fast to react, but they tend to tire quickly. And they are used for really big, fast movements, right? Like you're jumping off the ground. One of the most famous fast twitch muscles are your quad muscles. They help when you're like jumping up in the air, right? And they're just really those really quick, fast movements. Things like your hamstrings, your biceps, things like that. And the slow twitch muscles are slower to turn on. They can turn on for longer. They have more stamina, and they're used for more of a stabilization or supportive movements. So things like standing or sitting up, you have muscles that are made to help you do that without fatiguing, right? So you're able to stand for long periods of time without feeling that like lactic acid burn, because you have stabilizing muscles that help you to just kind of at like a 10 to 20% effort level, because you're just standing there, right? But it's keeping you upright. Otherwise you just fall over, right? So keep in mind that most of our muscles are a mixture of these two types. They're able to perform some combination of these two functions, because we are, again, dynamic and complex beings, right? There isn't just one and the other, and that's what they are. A lot of muscles are able to do both. And our pelvic floor, our levator ani, is one of those muscles. We want to be able to do both with our pelvic floor. Slow twitch muscles, that slow twitch aspect allows for sustained contractions that are needed for postural reasons. So Sarah, you kind of mentioned that. Things like breathing, allowing for resting tone so that we're not constantly leaking urine or feces. Things like strength exercises like planks, the sustained hold, and even before most big movements, you need a resting tone that allows you to sustain a level of support within your pelvic floor, so you're not leaking all the time and you're able to maintain your posture and standing or sitting position. And your pelvic floor is one of the main muscles in your body that help you do that. And you can even think about where it's located in your body. It's very central, and so you can imagine it has a big central role in that stabilizing task. And then fast contractions are needed for when we do things like sneeze or laugh or cough or lift or jump. And as many of us have experienced during those movements, if we don't have the ability to perform those quick contractions, it can lead to things like leaking or passage of gas, or maybe even more when we do those things, right? So now, one thing to also consider, especially for a particular population, is that all of these muscles meet right here in an area called the perineum. And I know we talked a little bit about it last week when we were thinking about our posture. That space that's directly between where your vagina is and your urethral opening where you pee, and you have your vagina here, and then you have your anus here where your poop comes out, right? And the space right between is where your perineum is. And as some of you know, that is likely where we tear during childbirth. And so you may have had some trauma to that area during pregnancy. And you can imagine having a tear there, having trauma in that area can lead to some significant difficulties in contracting your pelvic floor, because all of those pelvic floor muscles meet right there where you had that tear. Okay, so just, imagine your body is trying to recover from something very major like a tear, and having the patience to recognize, having patience is difficult anytime your body is recovering, but thinking about how much trauma it's experienced in that childbirth situation, and now it's it's a very integral part of that contraction, and so it does affect how we're able to contract as we move into our postpartum period. We're going to talk about that more. But first, let's think about what exactly is a levator ani contraction, or what it feels like, because it's not uncommon for us to not even know what it feels like, right? To not even really think much about it at all. And when we talk about a levator ani contraction, we are essentially referring to a Kegel. Okay, so all of the muscles are drawing in toward that perineum, and that space between where you pee and where you poo. All your muscles are drawing into that spot. And when people talk about a cable, that is what they're asking you to do, is draw up right into the center of your pelvic floor there. As I said earlier, with trauma, we can kind of lose our connection with that area, either due to the injury itself, pain-related reasons, or maybe even fear of moving that area due to pain. And this week, we're going to be working primarily on that contraction and relaxation of the area. So don't worry if you can relate to this in any way, or if when I talk about it, you're like, I don't have any idea what you're talking about. I don't know if I can even contract, or I can't even feel my pelvic floor. I don't know what you're saying. Don't worry, we're going to really delve deeply into that. And on this next slide, I have a video of a contraction that might be helpful with some visualization as we move into that space. Okay, so let me see if I can get it to play this.
The pelvic floor is the base of the group of muscles referred to as your core. These muscles are located in your pelvis and stretch like a hammock from the pubic bone at the front to the tailbone at the back, and from side to side. They support the bladder, bowel and uterus, and play an important role in bladder and bowel control and sexual function. If your pelvic floor muscles don't work well, you may leak when you do things like coughing, sneezing, lifting, laughing, or exercising. To stop this from happening, you need to switch on your pelvic floor muscles. To switch on the pelvic floor muscles, you need to squeeze and draw in the muscles around your vagina, as if you are trying to stop the flow of urine. Lift them up inside. Breathe normally. Don't hold your breath or tighten your buttocks. Then let go and relax the pelvic floor muscles completely. Notice as you tighten and lift your pelvic floor muscles, they tighten and close around the anal passage, vagina, and urethra. By exercising the pelvic floor regularly, you will train your muscles to work automatically when they are needed.
Okay, so I like that video because it gives you a little bit of an idea of what it can look like. And I think sometimes visualizations are really helpful. I'm not a big fan of how they talk about how to do it, but we're going to talk a lot about it. So we just learned a minute ago about fast and slow or sustained contractions. Now let's talk about voluntary and involuntary contraction and relaxation. Okay. Voluntary means things that we are actively controlling. So in the case of a contraction, an example would be the voluntary tightening of a muscle to stop the loss of urine or feces or gas. So it's essentially a Kegel, right? So if you are trying to hold your pee in, or if you're trying to hold in the passage of gas, if you're like trying not to fart, then that is a voluntary holding in, right? Voluntary contraction. A voluntary relaxation would be releasing that voluntary contraction when maybe like when you're on the toilet and you're ready to go, you relax everything, right? You should be relaxing everything to allow everything to evacuate your body. An involuntary contraction or relaxation is something that your body is able to do on its own without you actively prompting it. So a contraction for your pelvic floor would be ideally when you cough or sneeze or jump or laugh. Your sphincter should automatically contract in order to prevent anything from leaking out. Okay. Maybe previous to having children, you didn't really ever have to think about it because it wasn't an issue. And so that is the example of that involuntary thing, right? You're not like, all right, sphincters tighten up, you know, I'm going to sneeze. You didn't have to think about it. Your body just did it, right? Relaxation would be when you poop or you pass gas. Your pelvic floor should technically bulge downward without your actively bearing down in order for you to allow stool or gas to pass through your anus. And something like a full relaxation really only occurs during childbirth and maybe intermittently during defecation, so when you're pooping. It's really not like a pushing down. It's like it's a voluntary relaxation where you would have no say in what's happening. It's just voluntarily doing that on its own. I know it's a little complex, but we're going to apply it to real life and it'll make a little more sense. All right. You might have also just asked then if that tightening of the pelvic floor when I sneeze or cough or laugh is supposed to occur involuntarily, why is it that I'm not experiencing that now in my postpartum period? And that involuntary contraction reflex can be lost during pregnancy and after childbirth, which we talked about a little bit with something like trauma, right? You have traumatized muscles that are right there that are in charge of doing that. And so you have some recovery that needs to be done. But it also, there's a connection from those muscles to basically your brain, because your brain sends messages to your muscles even involuntarily, right? Like you're not consciously telling your body to contract, but your brain still sends messages to do these involuntary contractions, and you may have a disconnection where your brain is no longer telling your body to do that. And those kinds of messages can be retrained. We can get to a place, there's potential for you to get to a place where you're able to reestablish that connection and be able to involuntarily contract that without really thinking much about it. We are going to be working a lot on our voluntary contractions, and you can practice doing those voluntary contractions before you sneeze or cough or laugh or jump. And this can lead to retraining of that connection to your brain so that eventually, hopefully, you'll be able to regain the involuntary reflex. Okay, so the pelvic floor strengthening can help with this, right? It might be part of the factor of your leaking. If you're experiencing that, may be pelvic floor weakness, but it may also just be that you need to kind of establish that connection between your brain and that involuntary contraction that needs to happen. Kind of like a retraining, if you want to think about it that way. So you can see here, SUI in that picture means stress urinary incontinence. And what that basically means is that you can see in the picture, there's arrows pushing down on the bladder there. And so when you do things, and we're going to go over this in the next slide, when you do things like sneeze or cough, there's pressure that's being put on your bladder. It's pushing on your urine that's in your bladder and trying to push it out. And if you don't have that, whether it be that you don't have a strong enough pelvic floor muscle to hold it in, or whether it be that you're just not getting that involuntary contraction you need, it gets pushed out when you do things like sneeze or cough or jump or any of those things. So a good place to start with retraining is with understanding of how to breathe correctly. Breathing is so important to so many things, especially within movement and exercise. So to start with, I want you to imagine your abdomen as a container. And the container I want you to think of right now is a soda can. Okay, so the top of your abdominal can is your diaphragm. Your diaphragm is that muscle that's between your lungs and your abdomen. All right, so you can see the top red line in the image that's moving there. That's your diaphragm that moves every time you breathe. And then the bottom of your can is your pelvic floor, right? So they're both moving up and down, and they move together in tandem. Now, as you take a deep breath in, your lungs fill up with air and they push down on top of your abdominal can, right? So they push down on your diaphragm, and that pushes pressure on your abdominal contents, right? So all of your intestines, your bladder, everything that's in there pushes down on it. And as a result, your pelvic floor should involuntarily, right? You're not thinking about it. It should just relax downward in order to move with that pressure. Okay. So it shouldn't be staying straight. It shouldn't just sit there solid. It should move down because there's pressure pushing down on it. Okay. And then as you exhale, the pressure is released from the top because all that air goes out. Your diaphragm moves up, the pressure is released from your abdomen, and your pelvic floor can then involuntarily contract upward. So all of these things are going on without you really thinking about it, right? You're not really thinking about what your body's doing when you're breathing. You should be breathing all the time, right? So now I want you to imagine a can that you put on the ground to smash, right? But it's full. Like think about a full can of Coke and you put it on the ground, it's on concrete. You step on the top and the bottom of the can is on concrete. What's going to happen to everything that's in the can? Like say you're strong enough to smash it, right? All that pressure pushes out the side, right? Finds the path of least resistance and it just explodes out the side. That's a little dramatic for in terms of our abdomen, right? Our abdomen's not going to explode out the side, but I promise it's going to explode. But I do want you to understand that the general idea of pressure within your abdomen. And that's really what this is all about, is maintaining a healthy amount of pressure in your abdomen. So if there's pressure on the top being pushed down, you want that bottom part of your can to move downward and to move with that pressure that's going. If you're putting up resistance on the bottom, that pressure is going to push out in other areas that are that are kind of the area of least resistance. And that could mean pushing tissue out around your area, around areas like your belly button, and lead to things like hernias, or around your groin where you could get a hernia, something like herniated disc in your spine. All of those areas are kind of at risk for having an injury related to an unhealthy amount of pressure in your abdomen. Okay, so that is why breathing is such an important part of what we're doing with our bodies on a daily basis, both involuntarily and voluntarily when we do things like exercise or even lift our kids up. Okay, and so what I want you to take away from this slide, and we're going to revisit this a million times. Don't worry if you don't quite get it the first time. When you inhale, I want you to think about everything moving down. Okay, so taking that deep breath in, your lungs are filling with air, your diaphragm is moving down, all of your abdominal contents are moving down, and thus your pelvic floor will also be moving down. Okay, and then when you exhale, imagine pushing all that air out, and your belly button's going to go in, your belly's going to be a little smaller, or push inward, and then your pelvic floor is going to gently move up. Okay, so just kind of think about that as we move forward with everything. Don't worry, I'll be cueing that the whole time, but that is like the biggest concept to take away from this. Okay, so when you've gone through pregnancy, you have a human growing between your diaphragm and your pelvic floor, right? You have this big human being that's in between. And as you may have experienced, this can really affect your diaphragm's ability to contract and relax, which can be really hard to breathe. As you got into that third trimester, as you can see here, you have less room in your abdomen you have so much in your abdomen that your diaphragm has less room to contract downward. And so to compensate, our body opens up our ribs, right? Our ribs actually flare outward. Our body does this amazing thing of like, okay, she needs to breathe. So I'm going to flare these ribs outward so that we can have more space in our chest cavity so we can expand our lungs. And that's awesome for when we have the baby in there. It allows us to breathe. But in that postpartum period, a lot of times we have trouble kind of readjusting to not allowing our ribs to flare out like that continually. We've kind of changed our posture. Our stance has changed a lot. We've gone 9 months of carrying this baby in our belly, a lot of body changes. And so being aware of where our ribs at can really help us get to a place where we can breathe a little easier in that postpartum period. And also, it can help us reconnect our diaphragm with our pelvic floor. Okay, so having that baby right there in the middle can really kind of alter the coordination between your pelvic floor and your diaphragm during pregnancy and into that postpartum period. And that can then alter your abdominal pressure. And for some of us, this can lead to pelvic floor weakness, right? We've had a lot of pressure pushing down our pelvic floor for 9 months. It can kind of lead to some weakness in that area. Whereas for others, it can lead to pelvic floor hypertonicity, which is where we are constantly holding our pelvic floor really tight. And I know some of you might be able to relate to that. And our bodies have kind of compensated in that it's like, okay, I don't want to leak things out. I feel like there's a lot of weight on me, so I'm going to hold everything up as tightly as I can. And we move into postpartum holding on to that, right? We have this tight pelvic floor that's always holding on to. And remember that our can has pressure moving down from the top continually when we're breathing or sneezing or coughing or jumping. And you can imagine what happens when the bottom is resisting movement and it's holding on tight. That pressure needs to go somewhere. So again, you are then more at risk of things like hernias or things like prolapse, where you have your organs kind of push in onto your vagina or onto your uterus and cause heaviness in your vagina because you have organs pushing in on it, or things like leaking. So even though you are tight, your pelvic floor is tight and strong, you are still leaking because you have pressure pushing down on your pelvic floor and it has nowhere to go. So it pushes that urine out of your bladder, even despite you holding on tight, right? So all that to say, being able to help these muscles coordinate, both of them moving in tandem, your diaphragm and your pelvic floor, and more importantly, while you're breathing, and more importantly, while you're doing higher impact things like jumping, coughing and sneezing, and laughing, and other times of exertion can really help you lead to the prevention of leakage and protect you from injury that could lead to pain, sometimes really major injuries. Hopefully not, but it can. This is a preventative measure as much as it is kind of addressing the symptoms you already have. Okay, so let's revisit Kegels really quick. Again, they're not inherently bad. They're basically just a contraction of the pelvic floor all by itself. Okay, and the problem is we're not taught more than that. And once we get into our deep abdominals, which we're going to do next week, we're going to learn how to pair our pelvic floor contraction with a deep abdominal contraction, which is really important for everyday functioning, right? It's not often that we only contract our pelvic floor in our everyday movements. We're not just kind of only contracting that up. It's always working with other things. So you can understand how Kegels aren't particularly helpful when, like, from a functional standpoint, right? You're practicing something that you don't do on a regular basis by itself. The other thing is Kegels are not particularly helpful when you have a hypertonic pelvic floor. So you're already holding really tight. You don't necessarily need to practice holding even tight, okay? So relaxation is just as important as being able to tighten. Also, when we do that Kegel or that contraction, we should be timing it with our breath. Like we talked about before, when you exhale, you should be timing that Kegel, that contraction on the exhale when the pressure in your abdominal area is low. All right. Otherwise, you're placing a large amount of pressure in the pelvic floor because you're holding your breath or you're inhaling, pushing down your diaphragm, and then you're trying to pull your pelvic floor up on the same time. You can imagine both of those, the top and the bottom of your can coming together at the same time, just like when you're stepping on it, and all the pressure is just really building up in your abdomen. And one way to think about it too is, I've ever seen videos of Olympic weightlifters or like CrossFit lifters that pee their pants when they're lifting heavy weights. They're doing something called the Valsalva maneuver. And basically what that is you inhale and you hold your breath before you lift up. So you're lifting up this huge amount of weight, and they're looking for leverage in their abdomen in order to help them lift up. And so they inhale in order to create this pressure within their abdomen to push up. What that does is push down all that urine that's in their bladder, and they pee everywhere. Okay, we are not weightlifters. We're not Olympic weightlifters. We're not doing CrossFit and on a daily basis, right? And so we should not be holding our breath when we go to lift things or when we do heavily exerting things. We will be learning how to effectively breathe and contract our pelvic floor with our abdominal muscles so that we can do movements like that on the exhale, and hopefully that leads to us not leaking and not injuring ourselves further. Okay, many of you have had any issues with like back issues related to lifting or things like that. Understanding how to properly brace and protect your back and breathe as you do that can really, really help prevent further injury, and also strengthen the abdominal muscles and the pelvic floor muscles that you need in order to help your body recover and also prevent injury down the line as well. So you might be saying, I don't know what you're talking about. This whole time you've been talking, I've been trying to feel my pelvic floor and I don't know what you're saying. And I just want to say, don't worry. Don't worry. There are different levels of levator ani strength that can be affected by pregnancy and childbirth and age and all of these things. Lots of things go into what's going on with your pelvic floor. And building strength in any shape or form takes time and patience, okay? So even if you've been doing it right now as I've been talking and you're not feeling it, know that this could take a long time to really get to a place where you're feeling anything if you are just absolutely not feeling anything right now. Developing the ability to relax those muscles when you're experiencing hypertonicity takes time as well. You would think, okay, I should be able to just relax it. And sometimes when we have been hypertonic for long periods of time, it's equally as hard to relax as it is to contract. Okay, that's pretty normal. So don't worry if that's what you're experiencing as well. Visualization and practice will help a lot. I'm going to give you a lot of cues. I'm going to give you a lot of visuals. So don't worry. Hopefully we can get to something that is really helpful for you. And then if by the end of the program, you're still not feeling anything, you just totally lost, or, you're starting to notice other symptoms crop up, then consultation with a pelvic floor physical therapist might be helpful. And we will talk about more. I'm going to provide you guys with resources so that you can find one if you need to. And because I know that can be hard. A lot of people don't even know what they are, which is, unfortunately very common. And so they are wonderful and I love them, and they're often really lovely people. So we will talk more about that later. One thing that really contributes a lot to the ability to contract and relax your pelvic floor is your posture. So today for our workout, we're going to be covering a few things regarding our posture. And first, we're going to try out some posture cues. And posture can be a really helpful place to start when you're thinking about the movement of your pelvic floor. Pregnancy and postpartum really affects our posture in a lot of ways. We go through this really amazing but really fast transition in a short period of time that leads to a change in the weight in our front line, because we have growing breasts, we have growing uterus. There's a lot of fluid we take on. We have an increase in fat stores that are supporting us in our baby. And so it's no wonder that we have all these like major changes to the amount of weight we're holding in the front line of the body. And that can sometimes lead to compensations in our body, like rounding forward because of that weight. And a lot of times, even rounding forward in postpartum while we're holding and breastfeeding and doing all those things, and there's not a whole lot of movements to counteract that, right? We're not doing a lot of extension-based movements to counteract those rounding forward movements. And you can imagine that has a big effect on our pelvis as well. A lot of times we have our pelvis tilting in one way or the other because of that period of time that we have all that weight in our front line. As we move into thinking about our posture, I just want to make sure I say that there is no one correct posture. I think we are led to believe that, and we are led to believe that we have to maintain this very specific posture in order to be healthy and in order to be correct and well, and that is not necessarily true. More and more studies are finding that it seems a little more common sense as we move into this. I feel like things have been, this is more of the idea that we're generally accepting as people, but everybody's body is different, right? Everyone's body is shaped differently. We have different proportions. And so what can be a posture that works for one person may not work for someone else, right? So keep that in mind as we move through these cues, as we move through these things that I'm teaching you. Some things may work for you and some things may not. And you might find that this, if you find that you are feeling more strained or in pain, that may not be the cue for you. That may not be the position that you need to be in. Okay, so I don't want you to go into this thinking that if you can't move in the way that I am suggesting, that something is wrong with you, right? And then, because that is not the case. Everyone's body moves differently. I try my best to provide a lot of different kinds of cues, and I really encourage you to be curious about your own body. Know that, be a little open-minded about it, and know that you might have a different experience than everyone else. And I encourage you to let me know and to keep me updated on how you're feeling about things. Also, let's be graceful and forgiving about our posture, because I know that can cause a lot of shame, a lot of guilt, or a lot of feelings of like, I'm never in the right posture, then I'm just not good at it. We're not meant to be in perfect posture all the time, 100% of the time. Okay, our bodies are meant to move in a lot of different ways. So we're going to be looking into that today in just a few minutes. There's a little bit of a bonus here. We're going to also be doing release work throughout the week on some muscle groups that tend to like to take over during these times when we're compensating in our bodies. So these particular muscle groups really like to help us out when we are compensating the position of our pelvis. That can lead to some pain and tightness, and especially if they are these particular muscle groups are primarily used for fast twitch movement, but they're instead helping us with a more stabilizing job, right? They're helping us to stand upright, and their job has more to do with like doing fast twitch things. And so you can imagine a fast twitch muscle taking on a stabilizing job. It's going to fatigue really quickly. It's going to get sore. It's going to get tight. And that's kind of what happens here with these particular muscle groups. With our hip flexors, our obturator internus, and our piriformis, we really we can experience some tightness in those areas, and or fatigue, or just feeling, sometimes you get that feeling of like a really tight, like something's like really super tight and deep in your butt, in the front of your hips, in those areas. it could be a sign that those muscle groups are just taking over for you and helping. And we kind of want them to quiet down. All right. So we're going to be doing some work around those muscle groups. In addition to strengthening exercises, we're also going to be releasing these particular muscle groups so that they can just calm down a little and let the other muscle groups take over that we need. Okay, so one thing to consider, or one thing to think about, is when you should consider seeing a pelvic floor PT. We talked about it a little bit. I really recommend all women past 6 weeks postpartum should have at least one appointment with a pelvic floor PT. But if you are experiencing, in particular, pelvic pain, if you have known pelvic trauma, including perineal tears during childbirth, if you have urinary or bowel syndrome or symptoms, if you feel dragging or heaviness in your vagina when you do anything, either all the time or during exercise, if you have back, hip, groin, or tailbone pain that's persistent and you haven't really found an answer to, especially if it's made worse by what we're doing, or if you have pain or discomfort during sex, I really encourage people to go see a pelvic floor physical therapist. It can be so informative and so helpful, even if you go just once, to get there and get some information, understand what's going on. It can feel so empowering to get a little bit of a different perspective on your body than maybe your OBGYN can give you. But if we will talk about this during our one-on-one sessions if it's something that's appropriate for you, and I have resources for you guys as well. All right, so takeaways for tonight before we do our quick. Tonight's going to be a 10-minute workout. Okay, I know we're going over just a little. Just some quick takeaways. Your pelvic floor should be able to contract and relax effectively, both quickly and slowly, voluntarily and involuntarily. Leaking can potentially be lessened. You don't have to live with it. With proper bracing techniques and retraining of that neuromuscular connection to your pelvic floor. Your pelvic floor raises up on the exhale and goes down on the inhale. All right. And again, we're going to be saying that a lot. So don't worry if it's hard to remember. Breathing exercises are super important. So we're going to be doing a lot of those this week. Posture cues can help us more effectively use our pelvic floor. But let's remember to approach posture with curiosity and grace and forgiveness for our bodies. And then pelvic floor physical therapy is highly recommended for pelvic pain, or if your symptoms don't improve as we move through these parts of the program. Okay. Does anybody have any questions before we do our workout? No? Really? Okay. You're like, just get on with it. Let's do our workout. Okay. Let me switch over to my phone.
Sorry, guys.
There we go. Okay. So get a drink if you want. It's going to just be 1 second while I set up my camera. Let me stop sharing. Okay. All right. I am going to just quickly change my screen here. Do a mirror. Okay. Perfect. Okay, so For our workout today, you're going to need nothing. You're not going to need anything. Don't even worry. Just stand there. All right, we're going to talk about posture again. And let me get my timer. So we're going to do a quick stretch here for our hip flexors. Like I said, we're going to do a little release work throughout the week on these muscle groups that tend to like to hold on tight. And then I'm going to talk about posture in a way that hopefully helps you guys to understand it a little bit better than what we talked about during last week. Okay, so you don't need anything much. This is very low impact today. We're going to start with a hip flexor stretch that you don't need any equipment for. You've probably done these before. Really simple. You're going to do your left foot in front of your right foot. So you're going to be in kind of a lunge position, just like this. And we're going to be stretching. If your left foot is in front, your right foot's back. You're going to be stretching that front part of your right hip. Okay. And if with your left foot forward, you're going to reach your right arm up to the sky. I'm starting my timer here, and I want you to breathe into the front of your right hip. See if you can just take a deep breath in and relax into the stretch here. We'll probably sprinkle this stretch in quite a bit throughout the program. Like I said, you might have encountered this before. It's a pretty common one, but it can be really helpful. If you want, you can kind of tuck your tail under too. That tends to deepen the stretch a little bit. Just gently. Most of these stretches we're doing gently. I know, and when you're really tight, you want to really slam things out and really get a really super deep stretch. But sometimes that can kind of that can be a little counter to what you want it to do. So now go ahead and switch, put your right foot forward, your left foot back, and reach that left arm up to the sky. Tuck your tail just a little. Hopefully you're feeling a nice stretch in the front of your hip there. If at any point during this program there are movements that you're like, this doesn't work for me, this doesn't work for my body, it's okay. Reach out to me and let me know. I want to make sure that the things that I'm providing you with, the movements I'm providing you with, are helpful to you, and we'll find something that works for your body. Okay? Just something to know as we move forward. Take a deep breath, relax into your stretch. Really stretch that arm up to the sky. Next, we're gonna work on our posture, okay? So come out of that stretch. Go ahead and stand with your feet parallel, your toes pointing forward, your knees pointing forward. And this is gonna be me talking a lot, so don't worry. We're gonna get through it, okay? So knees pointing forward, toes pointing forward, and now we're going to think about our pelvis, because I know that it's a little complicated thinking about how to get to that neutral pelvis. And the reason why I'm holding a bowl with apples in it is because I want you to think about your pelvis like a bowl with fruit in it. And I think a lot of times when we think about our pelvis being neutral, I'm going to take this off. We think about a bowl that's sitting on a table, right? Flat on the table. And the problem with that is when our pelvis is flat, all the fruit is sitting directly in the middle. And that really prevents our pelvic floor from being able to go up and down like it needs to. Okay, so instead, what I want you to think about is your pelvis as kind of a slightly tilted forward ball of fruit. Okay, bowl of fruit. And the way to also think about it is I have my little pelvis here. You have all of this bone structure in the back. So you can see even as the way it's shaped, it's kind of slightly tilted forward, right? In order for it to be neutral, it's slightly tilted forward. And you have all of your organs inside sitting on top. That is the fruit. And so here's your bowl of fruit. You want that fruit to be toward the front of your bowl, not in the center. Okay, so we're thinking about our pelvis like this. We have a slightly tilted forward bowl of fruit, and then we have our perineum that's between where we pee and where we poop. And I want you to imagine that perineum on a beam. You have a balance beam going between your legs, you're straddling it, and you are gently setting your perineum on the beam. And so you have your bowl of fruit sitting on the beam. And I want you to think and imagine of just gently pulling that bowl of fruit backward along the beam, almost like you're saying, like, here's my fruit, and you're saying, you know, no fruit for you, right? You're pulling that bowl of fruit back very gently, and you're just gently shifting your weight back a little bit. Okay, sometimes getting a little slight bend in your knees is helpful as well. So you should be feeling, it shouldn't be a tilt, right? We're not tilting our bowl this way, we're not tilting our bowl outward, we're not shining our perineum back behind us. We are shining our perineum straight down to the ground, just behind our heels. All right, and this is something that you might not get the first time around, and it's okay. We're going to revisit this a ton. All right, so keep playing with it. It shouldn't be painful. You shouldn't feel like you're trying to hold your, I know when I first learned this, I kind of ended up tilting my pelvis forward even more and getting some, you know, feeling a little strain here in the back. We don't want that. We just want to shine our perineum back behind us, gently pull that that perineum back on the beam. Okay, it should feel easy, it should feel gentle, it should feel like a very slight, subtle adjustment to your pelvis. All right, try to keep your weight kind of in the center of your feet. I know we've slightly brought it back a little bit, it's going to feel a little weird, but we want to kind of bring our weight to the center of our foot. Our knees are still pointing forward, our feet are still forward. And then keep your pelvis as it is. Think about your ribs staying down. And then your sternum stretching away from your ribs, just gently, gently. We're not throwing our shoulders back. We are gently lifting our sternum away from our ribs. And we're thinking about our collarbones just gently reaching out to the sides. All right, almost like if your collarbones were one long stick, one long broom handle or a dowel, and they are just straight out to the sides. They're not back, straight out to the side, nice and easy, nice and gentle, just a gentle opening of the chest. Your shoulder blades are melting down your back, shoulders down, and the back of your neck is stretching up toward the ceiling. Your chin is tucked in, and your body is holding you up. Your body is strong. It has done so much to hold you up through everything that you've been through. And adjusting it to be in this posture doesn't mean you're fixing it. It doesn't mean that you are changing it in any way. It doesn't mean that it's been in the wrong position. It's been doing so much for you to hold you upright. Now we're just trying to give it the resources it needs to get some rest in the areas that it needs rest and to gain strength in the areas that it needs strength. Take a deep breath. And we're just going to breathe for the next few minutes here. It's going to feel like a forever, but we're going to breathe and we're going to feel what it feels like to breathe in this position and maintain this position for just a minute or two. Relax everything down. See if you notice yourself tightening up anywhere. See if you can relax again. Revisit your pelvis. Revisit your ribs and your sternum. Deep breath in and out. Don't worry too much about your pelvic floor yet. We're going to get into it. Today, we're just feeling what it feels like to get into that neutral pelvis. One more minute of breathing. Stretch that back of your neck up toward the ceiling, shoulders down, gentle. Everything is gentle. Everything is with ease. Shine that perineum back behind your heels. Be graceful and forgiving with yourself. We're almost there. One more deep breath in. And out. And you're done. Well done, everybody. I know that was a lot. I know that was a lot. It was a lot of sitting, it was a lot of listening, and a lot of breathing. We're going to do more throughout the week that gets you more in touch with your pelvic floor. Thank you guys for going over a little bit with me. I'm going to try my best to not do that with the rest of the program. Like I said, that's just a really dense talk. Things you're going to need for the week. You're going to need a chair, your strap, or something long, really long. I have a yoga strap. If you don't have one, don't go out and buy one. Look around your house, find something really long. I like to use the robe, the tie for my robe because it's long enough. We're not going to do anything major with it, and we're going to be wrapping it around underneath our boobs, okay, for some external feedback. So find that. You're going to be, if you don't already have it, you're going to be getting your ball and your bands from me. I sent those out to those of you who are not local, and those of you who are local should have gotten them on your doorstep the other day. And then you're also going to need a bolster or pillows that are comfortable to sit on the floor on. Okay, so something to kind of lift you up as you sit on the floor. I have a yoga bolster. If you have one sitting around, great. You can use a couch cushion. You can use rolled up blanket, or even like a rolled up thick yoga mat. Something that feels good that when you sit on the floor, you're not just flat on the floor, right? Something that lifts your hips up just a little bit. Okay. So yeah, that's what you'll need. I'll put that list on the group, so don't worry. I would have them all available close by so that when you need them, they're right there. Maybe put them up high somewhere so the kids can't get them, because otherwise it disappears. All right, so be ready for this week. It's going to be awesome. It's going to be great. Remember that your body holds a lot of stuff. Be forgiving with your body. We're going to be doing a lot with our pelvic floor, and that can be sensitive. So remember that. And thank you again. I'm going to be here for a few minutes. If you have any questions at all, I'm here to answer them. Otherwise, I'll see you. Have a wonderful night. I'll see you tomorrow at 8.
Hi, thank you.
Bye. Thanks, Carolyn. Bye, sir.